And thank you so much for joining us for this Project ECHO COVID-19 session during this unprecedented and challenging time. I'm Petros Levounis, and I serve as professor and chair in the Department of Psychiatry at Rutgers, New Jersey Medical School, and I will be facilitating this afternoon's discussion. I'm joined today by Dr. Cheryl Kennedy, who's a professor of psychiatry at Rutgers, New Jersey Medical School. She also heads IRB and has several other senior functions in the medical school. We're absolutely delighted to have her with us, and she's going to be giving us the didactic part about adolescents, children, and families in the context of COVID-19. More on that in a few minutes. I'm also joined by Dr. Clement Chen, our pharmacist, clinical pharmacist in the group, and Dr. Rashi Agrawal, who's an associate professor at the Rutgers, New Jersey Medical School, and also director of the residency training program. So, for anyone new to Project ECHO fosters partnerships between experts and frontline healthcare providers. It is based on education, begins with information, and extends to better outcomes. Today's session was specifically devised for frontline providers in outpatient settings. For anyone who's familiar with the Rutgers Project ECHO telemedicine clinic offerings, due to shifting priorities, we have changed our previously scheduled topic in order to focus on resources to our response to COVID-19. We appreciate all the questions you submitted upon registration. We're sensitive to the urgency of your request and are going to make an attempt to answer as many of the questions on this call. We have had over 1,200 questions submitted, so the Q&A feature is also where you'll be able to ask questions during this session, which will be compiled and presented to the speakers after their presentations. There will also be a significant amount of time devoted for questions and answers at the end of the session. Thank you so much for your participation. I hope we can have a rich discussion and ensure your patient care questions are answered during our time together. To introduce you to our technology today, if you have not already registered, we ask that you register using the link in the chat. This session is being recorded and will be distributed and posted on the Rutgers Project ECHO website after the session, including any links and resources shared during the presentation. Finally, as the timeliness of this content changes with each passing day, if you are reviewing this recording at a later date, realize that this may not be the most current information at the time you are viewing it. Note that information and websites for the New Jersey Department of Health, CDC, and COVID-19.nj.gov as resources for healthcare providers are given on our NJ Project ECHO COVID-19 webpage. And with this, I'm going to turn it to Dr. Cheryl Kennedy, who is, as I mentioned, a professor in our department. She also specializes in addiction psychiatry as well as child and adolescent psychiatry, and has particular expertise in trauma. So all this bring it together, Cheryl, we really are very honored and delighted that you were able to join us this afternoon.
Well, thank you very much, Petros, and I'm honored that you included me and asked me to do this. And I want to thank you, the rest of the ECHO team, and the technical group, which is assisting us so ably. Thank you very much, Ruben and Rachel. So, ready to go. Next slide, please. So we want to just look at some stressors, potential mental health issues, learn signs and symptoms, and talk about some techniques and things that might help. I certainly want to get to your questions, so this part is somewhat truncated about it's sort of the brief top line stuff. Next. So haven't we all had to establish new lifestyles, whether you're working from home or have to go to someplace to work, or you're working with your kids at home? Everything has changed, and we had to really ramp up being the day-to-day, minute-to-minute role models and establish new routines. Next. So first I want to point out some pitfalls, and then we'll look at some resources. Please avoid too much news for children. Some of us may crave updates. Those of us in the healthcare field, after we're busy all day, we don't actually check all the time, and we may want these updates, but we should avoid exposing children to too much of the trauma and loss that is out there. There's plenty of it to go around. We're all feeling it. So watch the news with your child. Ask them if they have questions about what they have heard, and let them talk about it. And of course, you have to be age appropriate, but please listen. Next. So provide reassurance. That's the most important things to kids. They don't tell us when they're scared always, but in this situation, we have discovered a lot of kids are scared and worried, and they're not sure how to express that. But we can help them by saying, that's what we're here for. We're here to take care of you and keep you safe. Obviously, we have to watch for troubled symptoms, fears, anxieties, sleeping problems, bedwetting, crying, talking about being afraid, and things like that. Next. So children will key emotional states from adults. So if you can, please avoid sharing too much emotion with children. Now, it's okay to say, of course, we're worried about grandma and we're doing everything we can do to help her. And when families have experienced trauma and loss, we have to be open about it, but at the same time, share the support that children will need. And unfortunately, we have found much too often now, death and loss is a part of everybody's life during this crisis. And we all are feeling it, but we have to try to deal effectively with our own stress. So our kids know that certain things can help, and you being in control helps the children or whomever else is around you. Next. Thank you. So parents can feel more in control by getting involved in local school stuff. I think that's a big issue. There are questions about schools. We can talk more in depth about that. But being involved and knowing what your school is planning and how you feel about that, what your preferences are, talk with other parents, talk with your school officials, and try to get involved in that concept, because everybody's struggling. All hands on deck. We need all people. We certainly need parents to weigh in about their concerns. Look, and if you need professional mental health, please try to get that for yourself. It is available. Your primary care physician may be able to help you if you're having trouble. Workers have health insurance, so they can go through that mechanism, and many, many people are now doing telehealth. Next. So different stages, different strategies. Preschoolers, they need reassurance. Involve them in learning good hand washing techniques and surface wiping. They need to be part of the solution as much as they are fearful about things. Early elementary school kids need brief, simple, healthy information. Again, reinsurances and the safety technique. Now, when you get to mid-elementary and on, they get more questions. You'll have more questions to answer and more concerns, but answer honestly. Help children discern the difference between facts and rumors and fantasy. There's an awful lot of stuff like that around, and we have to help kids distinguish. High schoolers, they're in a whole other category. We know they're going through their adolescent angst, let's say. So we need them to be, again, part of the solution, and refer them to good resources and engage them in the decision-making, how schedules are going to go and what their preferences are. Because remember, even though we want them to be at school all day, that is not always possible. So we have to be a little flexible. Next. Actually, I think we have to be a lot flexible. So we want to monitor the stress in adolescents and teens. These are the higher risk group kids, their thoughts, their feelings, what they're doing. Listen carefully, watch for overloading, check for self-harm if kids are isolating, which is common during adolescent years, especially with video games. But they need you to check in on them. Learn, model stress management skills. And support an environment that includes involving exercise, other pro-social activities, Zooming with friends, setting up virtual groups to have parties. Think about, ask them to get a theme going. And, you know, teenagers can be silly and have fun doing stuff like that. Next. So the fear and anxiety is one of the biggest things. So that can be dissipated by being in control. Kids can be involved in understanding that safety measures are a way to combat fear. You can make a game out of it. Rules can change as the family learns. There may be mini prizes for whomever washes their hands first, or get everybody together to wash hands. If you can't muster prizes, think of some way to reward someone who is doing a good job. Explain social distancing and why it's important. Practice wearing masks at home, especially with younger children, and staying apart just as an exercise to practice. How do you do that? So we can prepare for reentry. Beside, you know, look, it's serious, but if we can make a game for it for kids, they will be more engaged and understand it better. Next. So if there are prior mental health issues, or children with disabilities, other relatives, maybe older, who need care, there's prior trauma floating around. Some families have a lot of instability and they're going to suffer more than some others. And those who have more losses and new traumas. Please don't forget that there are women and children trapped in abusive situations. And please try to know your resources. I am providing some of those as well at the end. Next. So preschoolers regress, they thumb suck, they bedwet, they cling, they have sleep problems, they have more fear of the dark perhaps, their appetite might change, they might be more withdrawn. These are some of the warning signs for this group. In elementary age, you want to watch out for increased irritability, aggressiveness, school avoidance, poor concentration, again, withdrawal and isolation. These are key flags we need to pay attention to. And adolescence, changes in sleeping, eating, increase in conflicts, physical complaints, lack of motivation, delinquency even. A lot of that is happening. Kids sneaking out and doing things at night that they shouldn't be involved in. And poor concentration. So, you know, the adolescents, and of course the youngest children, not to mention everybody, needs attention on these issues. Next. So, what is good for all of us all of the time? Eat, exercise, eat a regular good diet, exercise, good sleep routine, get enough sleep, make it a family project. Avoid caffeine and increase feelings, because it can increase feelings of anxiety and agitation. Avoid drug and alcohol use, including tobacco. These are health harmful, maladaptive coping mechanisms. Learn relaxation exercises, abdominal breathing, and muscle relaxation techniques. These are all over the internet. So they are available in very simple ways. Next. So we have to develop new skills for the future. Assertiveness training skills, for example, help yourself and others, especially kids, state their feelings in polite, firm, and not overly aggressive or passive ways. Say, I feel upset when you're yelling at me. Please stop yelling. Or help children establish safety boundaries in social distancing to say, please move further away from me for safety, and teach children how to do that. We also have to practice and rehearse situations which cause stress. So again, the safety skills, practicing with kids, wearing masks. I can't emphasize how important that is, because children are some children are very sort of creeped out by the mask thing. Washing hands, coughing into elbows, cleaning surfaces, all that. Rehearse it, do it. Learn practical coping skills. For example, break a large task into smaller, more attainable tasks. Decrease your own negative self-talk. Challenge negative thoughts with alternative, neutral, or positive ideas. And please try to involve the children in problem solving and decisions as appropriate. Next. So give yourself, your partner, your children a break. Figure out something fun. We all need that. Look, this is hard for everyone. Everyone can't be as structured as we wish, so we have to develop some tolerance about this. It's not the end of the world because kids are missing 2 months of intense instruction. Most of our children will be able to catch up. Be polite, be kind, teach children and others how to be positive and problem solve. Develop resilience. We're all going to need it. This isn't going to get a whole lot easier going forward. Please reinforce nonviolent conflict resolution techniques. It will lower the stress and less conflict. Next. So here are some resources. There's a couple of pages of these, couple of slides. There are all kinds of things. It's food banks, tips for families. The government has stuff out there. Domestic violence hotline, women's shelters. Next. And the ARC has resources for families with disabilities. And there are a whole lot of different types of apps that can help. Calm.com is one that helps people, and they seem to like it. There are tons of kid-friendly cartoons for kids out there on the internet. So almost everybody these days, certainly folks that are watching this, have access to the internet. So please try to use the resources that are out there. This is a short list. Your own personal, professional health organizations will also have resources on their websites. Now I'd like to share with you a technique. I engaged someone to develop a video that might be useful for children. It's about 1 minute, 20 seconds. So I ask you to join me in watching Addie, who's going to provide some guidance for kids. Next, the video.
Sure. Okay, so we're just going to load it up. If no one hears sound, please, Cheryl, if you could just let me know if the sound isn't playing, but I'll go ahead and share the video now.
Thank you. No sound. I'm not getting sound.
Hi, my name is Addie. I have a message for children and families all around the world. I found out that because of the virus, which is a germ that can make us sick, we all have to stay safe, especially when we go out of our houses. To be safe and not feel scared, we all have to know the safety stuff. Number 1, wash your hands a lot. Clean surfaces you will use. Number 2, we all have to learn how to put on a mask. You will notice when you go out in the car, you will see that people in shops, parks, and schools, they have masks. This is how you put on a mask. There we go, one mask. Number 3, cough into your elbows or tissues. Use hand cleaner if you can't wash your hands. Try not to touch your face. Number 4, social distancing. What's that? It means that we can't be close to other people. We have to leave some space so we can't pass the virus around. If we follow these rules, we can feel safe and less scared. And kids, if we work together, we can learn how to adapt and adjust to try something new. After all, we are humans, and don't forget to be kind.
All right. Well, thank you, Addie. That was very helpful. So what you can see is that children can be involved. They could draw pictures, they could write stories at any age. That child is about 5 years and 3/4 old. I think she's going to be 6 in late September, but it looks like a budding actress. Now, I'm going to address some of your important questions. One is a question about a child being shunned by her friends because a parent takes care of COVID patients. This is really important, and the context is important. For example, is the kid being shunned virtually, or is this something about a contact shunning? And really, we shouldn't be having contact right yet. Kids are still, we're still in this stage, gradually opening up. But please, I think it's important, maybe you could contact the parents of other children and develop as a group a way to address this kind of problem virtually. And it depends on the child's age and what they can understand about how this is going. But you have to give reassurance that not everybody is as good and as kind as you are in your family, and how to help children process that kind of compassion they have to develop for everybody. Another question comes.
Cheryl,
Yes.
This is Petros again. Thank you so much for the absolutely wonderful didactic part of this session, and thank you for starting the question and answers. We try to intersperse some of the live questions with the ones that were submitted. So let me just read some of the ones that we just got from the audience as we speak. We got a lot of thank yous for the Abby post, and people want to know where they can get that. So I will let Rachel help us with this and maybe upload the link in the chat room. So as mental health providers, what would be a good way to be able to do our job from home and also manage homeschooling with a kindergarten child and a second grader, especially since a single mother, children are frustrated with the little time provided to complete assignments?
Yeah, this is probably the toughest thing of all for parents who are trying to work from home and also trying to manage the homeschooling bit. Of course, it isn't really homeschooling. The school is supposed to provide the schooling, and the parent has to provide the context, and the children, of course, have to cooperate for it to work. Now, it's very variable among school districts, as you know. Some have a lot of work and some don't. But try to work with the children to set it up at the beginning of each day. Now, you're going to be here in this spot. You're going to be over here to the other child. I have my spot to work. We're going to spend a few hours doing what we have to do so that the children can get structured in that. We're sort of at the end of that business because school is starting to wind down. So hopefully you're able to flex that somewhat depending on your school and what their requirements are, and of course the age of the kids. I have found in families that younger children, even kindergarten kids, enjoy the Zoom thing, seeing their friends and other people, and many of them are getting very well involved. So you have to try to do the best you can with the situation and setting up in the household. That's one of the hardest things. So, and many people don't have multiple sets of equipment. They only have one computer maybe. So this is going to be challenging, and we have to try to share that as it goes.
Let me invite the other panel members as well, because this is a recurrent question on how to balance the schoolwork and the life at home with the children and all the responsibilities that people have when they telecommute with their 9-to-5 job. I know we have some parents in the panel, and jump in.
I couldn't wait to jump in, Petros, because I think the big reality here is that, you know, I have two kids, and one of them is loving the virtual schooling, and she's older. But my other kid, who's 10, I can tell you that I've not gone through this much pain since I was waking up every 30 minutes when he was a baby. So one thing is really, and in his classroom, he's in a school where there's very few kids. It seems the same schooling. Some people are flourishing and enjoying, so just remember, like, one is just because other kids are doing very well with the virtual curriculum, it doesn't mean that your kid and you will, and that's not us failing as parents. The other thing that I sort of realized, and again, because what Cheryl is talking about Zoom classes, for me, the biggest struggle was that there wasn't enough interaction with his teacher. So, in the morning, he gets a long list of things he has to do. Now they suddenly expect him to do everything that he was doing in school in those schooling hours all day long. And what they don't realize is that means that every step of the day, you are supposed to be helping your children do it. And our children are not all independent, and they will not all do it by themselves. So the one thing that worked for us is that we would take the school schedule and modify it for what works for our family. And two, we negotiated with the teachers, and not everything that the school is giving is really an important milestone that your child has to do. So they will give a lot of activities that are for filling in the time. So for example, there was one music assignment that took 3 hours of combined family time of 4 people helping him do this. And at the point I'm like, you know what, if he doesn't do this, he won't fail 5th grade. So I think basically don't try to do all activities. Don't think of it as every school activity needs to be completed. Negotiate with the teachers, figure out what is feasible for you as a parent and a family.
I couldn't agree more. Just gonna add here, all of us have seen the viral video of the Israeli mother who's up to here with distance learning. I think it's probably one of the most watched video ever. But it would be wonderful if you check out the follow-up video when the kids go back to school. As it turns out, this Israeli mother is actually a teacher herself. And so she's on the other side as well as being a mother, but being a teacher. And I very much love what Rashi said of negotiating with the teachers. A lot of these teachers are parents themselves, and they have to go through a similar situation. So, and I think that they have the responsibility to try to cover as much of the curriculum as possible. But if you tell them, hey, look, this is unreasonable, they will understand.
Yes, thank you, Rashi and Petros. I couldn't agree more. The parent being involved, but of course, that's another burden on the parent who has to work and then so there's a lot involved in this, and we have to give a lot of flexibility. Working with the school is key, I think, and it is going to continue to be key going forward as we try to figure out what September's ed school is going to look like. So we have models in Europe in different things.
Oh, go ahead, Cheryl. What kind of models?
Okay, another question from the previous list, Petros? Or?
Sure, just a very quick one. Do we have Abby's parents' permission to share the video? I would like.
Yes, I'm sorry I didn't say that. I do. I do. Yes.
All right, go ahead.
It's considered a public service announcement, if you will.
Right. So go ahead and let's go over one of the questions that were submitted online.
So I have a question about a woman, I don't know, I beg your pardon, I don't know who it is, but working in a nursing home and seeing depression among the residents. I myself work in a nursing home, and just this morning I did a telehealth session with several patients in the nursing home to keep up with their care. And the nursing home is very helpful in that. But for workers at the nursing home, what they have found the best thing to do, and you're right, these patients are isolated, they're kept in their rooms, activities are down, all that, is to facilitate their contact with families through telemedicine systems, through FaceTime, whatever methods they can get. Most of the staff in the nursing homes are using their own phones. Some patients that I know have phones, and those are the phones they're using. So this is a very challenging situation, and we have to do our best. But again, these are among the most vulnerable people, so we can't just let it all go. And we have to find the balance in between.
If I can add to this here, the second
Sure.
part of this question says something like, any treatment recommendations for this situation beyond antidepressants? By all means, we want both pharmacological and non-pharmacological interventions for depression, but I just want to dispel one myth about depression that keeps on coming back. And that is that if we have a very good reason of why the person is depressed, then medications are not indicated and psychotherapy and counseling are indicated. It's an old frame of mind having to do with what really caused the depression. So I'm saying this because, of course, with COVID-19, you have very good reasons why you may be depressed. And in some people's mind, that may lead us in a way away from medication. Not true, absolutely not true. If the depression is severe enough, no matter where it came from, it came out of nowhere, or it's because of COVID-19, or because you lost a loved one, or have a lot of grief going on around. But if the depression persists and it's severe enough, it does need medication. With psychotherapy and counseling, that would be wonderful to add those components as well, but don't deprive a patient from life-saving medications just because you know the cause of the depression.
Yeah, that really needs to be emphasized, Petros, because we know this older population, many of which constitute the population in nursing homes, do not get adequately treated for depressive symptoms. And we should be using medications in this group as indicated. So that's important. Thank you.
Sure.
If I could just add one thing.
Sure, Clement.
Particularly in certain maybe traditional cultures where maybe they see mental health treatment as, as a stigma, because, if they see a mental health professional, they think maybe they're losing control. And Dr. Kennedy, you mentioned a lot about that. So I think that might lead to a lot of depression. And in order to how would you like maybe talk to someone like that older person, like to really seek treatment for, psychotherapy and things, especially if, they otherwise would not, because thinking that if they seek a mental health professional, they're like losing control of the situation.
Well, as we know, on the contrary, they may have the opportunity then to gain control and feel more in charge of their own health and well-being and how it's being handled if they can just try talking with somebody. Often you have to, work hard at engaging people who feel very stigmatized. Nursing home care is a little bit different because patients don't necessarily have a lot to say. Yes, they can express preferences and this and that, but providers tend to treat what they see needs to be treated in many cases. And that's where it falls off, because they often don't treat depression when they should, so that is a big feature. And of course, people have experienced tremendous loss just because of the isolation. And as an older person, that is very difficult for them.
Let's press here a little bit.
Yeah.
And that is, you have an elderly patient, you have diagnosed depression, you know that the patient requires, let's say, antidepressants, and the patient, I'm not crazy, I've lived all my life and I'm fine, I don't want any pills,
Right.
this and that. How do people feel about bending the truth somewhat? A lot of elderly patients also suffer from insomnia or physical pain, and we do have bona fide indications: duloxetine for pain, paroxetine for pain, mirtazapine for insomnia, and so on, and just kind of start giving the needed medication under somewhat bent counseling. I don't know how else to put it.
Many of these antidepressants also help with anxiety, and that can help with sleep. if that's a problem, if the anxiety is why people are staying awake at night or having that kind of difficulty. I agree with you. I think we have to use, it's a matter of interpretation. These medications have a lot of effects. So of course you have to reinforce the idea, I don't think you're crazy. By the way, I'm the psychiatrist, so I don't think you're crazy. but I do have some things, and I'd like to try them. I'd like to work with you to try some medication that may help some or all or any of your symptoms. But we have to try. We don't know if we don't try. And thankfully, many of the antidepressants have a low side effect profile. And in the elderly, we would start always with small doses and help people understand as they age, even though they may have had a wonderful life and didn't have a lot of depression or difficulties or anxiety, the brain changes as we age and circumstances affect this, and we have to deal with the problems we have in front of us.
There are a lot of psychiatrists or several psychiatrists who suggest that after a certain age everybody should be on an antidepressant. Our brain does not make enough serotonin, and you need to replenish it, not unlike vitamins or a bunch of other things that we take to replenish stuff that our body may not have enough of it as it is. I do want to hear what Clement and Rachi think about this issue of bending the truth a little bit in order to serve what we think is best for the patient.
Petros, honestly, I don't consider it bending the truth at all. As a CL attending, I would actually ask the patient what is bothering them and what they are willing for me to help them with, medication-wise, therapy-wise. Like, I usually start the conversation with, this is what I think would benefit you. What do you think would benefit you, and what do you want? And routinely, we focus on symptoms like sleep problems, weight loss, and pick medications that would have that as a side effect or would benefit them in that way. And also talk about, I think the one thing that I've found is that a lot of times patients are resistant to antidepressants because there's this perception these are addictive medications and you can't get off them. So by also saying, hey, why don't you try this antidepressant or this medication, which really will help you with sleep, and you can let me know at any time you want to stop. There is no tapering off. There's like, you are in complete control from the first day. So try one dose and then let's see what you feel about it. So it frequently succeeds that way.
Go ahead, Clement, sorry.
No, I agree with Dr. Agrawal and Dr. Levonis here. I think, I also think that people don't want to be on antidepressants because of, like we discussed in the initial question, the stigma, of just being on one. But I think from a pharmacist perspective, when you're counseling someone, after they're prescribed it, if you prescribe it, what's the primary reason that you're prescribing it, and that improves, then later on in the discussion, you say, oh, secondarily, how are you also feeling? Then they may actually, become more receptive towards the other secondary treatments, namely the depression and all that.
I agree with you, but you talk, all of you, including myself, all of us, as if we are the primary source of information for the patient. We are not. The internet is the primary source of information for our patients. So as soon as you prescribe to them venlafaxine or fluoxetine or whatever it is, click, 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 Wikipedia. What is fluoxetine? Antidepressant, antidepressant, antidepressant. And that is the major thing. And that's what we have to deal with. So I wish that we were like in my father's day where, the doctor was the source of information and that's what it was. But nowadays, I think we're like no more than 30% of the patient's information.
Yeah, I couldn't agree more. Now, that may be less in the older population, but in general, people do, and they have trouble interpreting that information. And that's another area where we can be helpful, sending them to reliable sources for their information and helping them navigate, because the internet is really the Wild West of data and info and how to interpret it all.
I'm going to go out on a limb here and say, bad mouth as much as you want, people about the internet, and you're very correct, of course, Cheryl, that it's a mixed bag of good and bad things. But when it comes to Wikipedia specifically for our patient does give pretty good information. There are a few things that in psychiatry and addiction specifically that I feel that I know as much as there is to know about. And I've checked Wikipedia in those areas, and it is not bad information. So at least we have some allies out there that maybe it's the iterative process of people correcting themselves, whatever it is, that end up with some good information.
I agree with you, Petros, on the Wikipedia, absolutely. I think the question of addressing what's on the internet versus what we are recommending, it really comes down to our relationships. So even if it's the first time I'm seeing a patient, if the patient feels that I have a combination of both, that I understand them and their problem, and I'm an expert at the same time. So I think for patients, those are the two things. Then they do take your advice much more seriously. And having a context like, I have experience with working with patients, others like you, people who have been in your circumstances. That really goes very far.
Yeah, I agree, Rashi. And you know, really engaging so the patient, you have rapport. If the patient trusts you and likes you and think you're really going to help them, and that's your interest, then they're liable to take your recommendations and be engaged in their own treatment. That's what's important, that it's a dialogue too with the patient, and that we can get something going, as you mentioned before. What are their preferences? How do they think things would help? That's so important. And I think that's also important for children, that we talk about, help them express what they feel and think, and then we can figure out, are they really on the right track there? What's happening? Do they have these distorted ideas? Because of course children are somewhat the easiest to help, because you're their teacher, you're their parent, or someone that's close to them, so you can give them a way to help understand information that is appropriate for them.
All right, let me get some questions here going. A lot of positive feedback. People like the workshop, so thank you very much. Great tool to get the kids involved in a healthy and understanding way. Dr. Agarwal, I feel your pain. I have a 10-year-old, and I think with this homeschooling has developed ADD, laughing out loud. So people seem to be relating to what we're saying. Some comments: music can be inspiring to the elderly. And another comment: if an elderly person who is confined, I wanted to say, I'm sorry, I think it's important to add vitamin D where it is not possible for the elderly to be outdoors. Other creative ideas such as having plants and colorful clothing, artwork, meditation, etc. Thank you very much for these comments. All right, here's a question. If an elderly person who is confined to a nursing home and has lost all independence and control of their life suffers from depression from this circumstance, how can meds really help when circumstances will not change?
Well, I think psychiatrists understand this a little differently. Yes, circumstances are obviously important, and people that feel hopeless and that nothing's going to change in their life is a significant thing. But we know that medication can actually change the way people feel. That's a well-known thing all over the world. Drugs change the way people feel. And that's the goal in medication. Even though the circumstances cannot be changed, perhaps we can help change their inner life in terms of their neurotransmitters, so we get things in better balance, and they can develop a more positive outlook from the inside. Now, we have to help that. We have to present positive context.
We just got a very, very apt comment here. We have moved off topic. This is not about medicating a patient. This is about children and family.
Thank you. Thank you. That was bothering me.
Rima sent that to us right now, so that is good. So, Cheryl, pick one of these adolescent children and families questions from the ones that were sent online, and let's address that one.
Right. There's a question about a child, doesn't say how old, that telling her parents that they don't care about her. And we care so much, the person says, but she shuts us out and constantly lashes out. Sounds like she's very irritable and stressed. And how can we be empathetic and show we care without giving in and losing control? I'm not sure what it means by giving in. So yeah, we talk all about this structure and all about this routine and how kids have to do this and kids have to do that. And if we are not flexible in that, children may interpret that as we don't care about them because we're shutting them off into this thing. You have to do this, you have to do your schoolwork, and this is the structure we need. So we have to really learn how to have a routine and a good structure that's healthy, but to be flexible. This child may be just crying out for help, and that someone really needs to sit down. She lashes out. You have to sort of take the abuse and let her express herself, or I don't know if it's a girl or a boy. Oh, it's a daughter, this person. But so that you can say back to her, oh my gosh, you're so upset. You know, you need to talk with us about this. Why do you think we don't love you? We're all in, you know, and try to get the dialogue to be a little more profound so that people can sort of enlarge a way for the child to be expressive. Look, no parent wants to be told, you know, bad words or leave me alone or all this nasty kind of stuff we get, especially from adolescents and early teens. At the same time, who else can they say that to? Who isn't going to tell them to go jump off the bridge, I'm never talking to you again, or whatever it is. So we have to be able to accept some of this, quote, abuse and realize it's not personal, that we are the adult. We have to help the child develop that, all those feelings, change those feelings and understand them better. Maybe the kid needs professional help. Don't discount that. My goodness.
A follow-up comment on that from Suzanne. Is the child getting enough physical activity and affection? I like how you put these two primary things, physical activity and affection. If all of us were to get physical activity and affection, I think we'd be so much better off. But let me hear from other panelists as well about the issue with the daughter who keeps on saying that the parents do not care.
I completely agree with Cheryl's approach in this, because I think as adults, we are really supposed to absorb a lot of our children's emotions. And they really come out to the front when you have a preteen and teen daughter. I think sons tend to express it more physically with more anger, aggression. Daughters really, my husband and I'm looking, if my daughter won't hear me, we have an ongoing joke. Like, it's very hard to distinguish bipolar disorder from a teen girl because they have mood swings. But recognizing what that means and how to sort of absorb that emotion and be there, I think the one very important thing for parents is to let out your distress and your upset and have safe venting when the child can't hear you. So it is usually with each other, but because when you are ready to listen to them, what I have seen is that unless I have processed my emotions, I sort of get into an argument, or it's very hard to listen to somebody vent and be angry at you, which is sort of unreasonable unless you're calm yourself. So when you are ready to have that conversation with your child, you really have to be willing to absorb a lot of it. And for that, usually one parent takes on the lead and the other parent supports that parent, is how I think it works much better. But anger and aggression is just a way for a child to sort of be independent and sort of learn their boundaries. And I think structure should be negotiated a lot with the teens, in the sense you let them experiment to some degree, where they figure out what times work for them, when they want to work. They're learning how to be becoming an adult, basically. And you have to give them a lot more room to both grow and fail in a safe way.
Yeah, Rachi, that's really important, because we know if they were going to school and doing their ordinary things, they would be having, you know, the same kind of stuff in some ways, but it would be managed different. Now it's under our nose and in our face all the time. And people tend to feel that it really is being directed at them. And that's probably not true. The kids need to learn. I mean, I love the exercise and affection. Kids really need that. You know, these older folks, they're not getting hugs. The kids, you know, we have to really go out of our way and establish. I mean, the exercise is a huge family thing. We need to all do it. So it is helpful.
Good. Let me get a couple of more things. What about teenage boys who are unwilling or unable to discuss their feelings? So let me take that really, really quickly. I think we can borrow from addiction medicine, from addiction psychiatry here. I would very strongly recommend motivational interviewing. A whole field of addiction treatment has been built around people who are unwilling and unable to discuss their feelings and their problems and anything else. Motivational interviewing has wonderful techniques of starting the conversation, even if the person does not want to hear a thing about feelings, about changing anything in their lives, about stopping smoking or quitting marijuana or whatever it is. So do check out some of the motivational interviewing techniques. I think they will be quite relevant here. There's another comment, a very correct one, but it is directed directly to me. It says, patients cannot trust you if you feel threatened when they question medication regimens. Absolutely correct. If patients choose to do the research, that should not be viewed as a challenge. Yes, back in your father's day, the doctor was trusted. However, that has led to disparities within the medical community and has led to distrust. You are absolutely correct. Patients should be encouraged to do their own research. Patients should be encouraged to get second opinions, whether it is virtual or real life. And we should be humble in the things that we know. A lot of the things that we know are sometimes outdated. We bring things back from our training, which for some of us was 20, 30 years ago. So a lot of respect for our patients who do their own research. What I would like to ask is to be a partner in metabolizing this information that they bring from the internet, to be a partner in this kind of shifting through all this information.
Yeah, like the respect for the patient trying to do their own research, that's part of the engagement process with the provider. And we have to sort of capitalize on that. We need them to partner with us.
Mm-hmm.
Patient-centered care, right? Everything's
There you
on that patient.
Yeah, a little easier said than done, especially a generational issue when somebody comes in and said, but doctor, I did see on the internet that what you just said, and yes, this has to be taken into consideration and absolutely addressed as well. Okay, I got a lot of more thank yous and great workshop. For a future topic, can we discuss the prevalence of depression in SNF and ALF settings? Seeing such an increased incidence of depression due to the isolation, yet the homes are so resistant in starting meds for these residents. So yes, we'll be thinking about these matters for future topics. I think we have time for one more question. Cheryl, if you, from the list that you have in front of you, if you want to pick one, you should be able to do that.
Okay, at this point, I would like to listen more on how to deal with getting back to work and school. I'm still nervous and anxious. I don't know, provider, parent who's sending this, but how do you keep explaining to your children they will have to continue following certain rules? And the person says kids are depressed. Well, you know, not all kids are depressed, but yes, certain rules are part of our existence. And now, as I was talking about earlier in the lesson part there, we have to learn to adopt new skills and adopt new practices and bring the whole family along with us. This is not just going to be, oh, the kids have to do it. We all have to do it. And this is going to be a work in progress, especially over the next few months and the school year coming. So I can't emphasize enough how important I think it is for parents to be engaged, not only in their children's day-to-day lives, but in how it's going to go forward and help them practice and adopt. Like I said, we have to make games. Little kids, they can learn how to wear masks and they can learn how to social distance, but not just, it's not natural. It's not automatic. We have to work with them and teach them. And if we can feel that these things will be helpful to keep us safe, then the kids will realize that and they'll go along over time. Some kids are always going to be outliers. Look, not every kid is the same. And we have to address specific issues with specific children, that's for sure. But I do think we cannot let anything out of the box. We have to use everything we have available to us. Professionals, apps online, relaxation techniques, running, you know, exercise, games, whatever it is, we have to use all of it. so that we could be successful in this.
Great. All right. Final thoughts, Rashi, Clement, about the things that we've discussed.
I would just like to say that I think with children, one important thing is to learn that there's no absolute, and you really have to be very flexible and forgiving for yourself as a parent, not even with kids, because parenting is really, really difficult. And in this time where you're trying to balance work and taking care of your children and doing things that normally teachers would do, it is especially challenging. So cut yourself some slack. It's okay if things are not as perfect as they were 2 months ago, and let go of certain things, and that's okay.
Great. Clement, any final thoughts before we close the webinar?
I think it's probably just the way in which, the method in which we talk to kids. Obviously, you know, now that I'm older, I can see that, like, my father, like during times of stress and during like a pandemic, he's just always in a more defensive manner, always yells. And as a child, I'm always there to just, you know, like not listen to him. So right now, you know, when I interact with my father, it's always, I can't believe I'm doing this on you know, but
You're among friends, Clement.
it's difficult to, you know, communicate with him because, like, you know, he always thinks of the past as shaping who I may be right now. But I know that deep down inside, he has a kind heart. And I guess, you know, the delivery and methods that the way in which we do share information is very important.
I couldn't agree more with you, Clement, and Rashi as well, and Cheryl. But when I hear ourselves, sometimes I hear myself like, we must do this and we have to do that. And it's so important that we do this. And of course, we're passionate people. We like to kind of share our thoughts. But the way we deliver these things sometimes is a little counterproductive and not very motivational, interviewing informed. So we always have to keep that in mind. All right, before we close, we got some great thank yous here from Atlanta, from Colorado. We got a comment from Manjo who said, thank you for showing us both your professional and personal selves. It's very refreshing, which is very sweet to hear. So as we approach the end of today's ECHO, we want to thank you for attending and participating. This session has been recorded and will be made available on our, I'm sorry, New Jersey Project ECHO COVID-19 website. We would also like your feedback regarding your interest in participating in subsequent sessions on this subject. Please take a few moments to complete our post-session survey so that we can gauge your interest and plan for upcoming sessions. Our next COVID-19 ECHO session will be next Friday at noon. And I'm delighted to say that the title for that session is Moving into the Future, What's going to happen after COVID-19. So I had advertised that we're going to have a guest speaker for that session. And after giving it a lot of thought, could go in one of two directions, either maybe a national expert like what we had last time about the future with Dr. Ginasi. But I went in a little bit different direction this time, and we're going to get a bunch of medical students. We're going to have fourth-year medical students taking 5 minutes each and telling us about how they see the world, how do they see the post-COVID-19 era unfolding in front of us. Just as a teaser, we'll have one of the medical students who's an accomplished violinist herself talk about how music will be impacting the post-COVID-19 era. She agreed to bring her violin and play some passages for us and show us how music really would be so central in counseling, psychotherapy, and mental health of the future. We'll have some other ideas from other medical students. I can tell you they have been super excited about next Friday, and I can't wait for us to welcome them in our session and see how we can perhaps appreciate out-of-the-box ideas in moving forward. With this, I want to especially thank Cheryl Kennedy, Dr. Kennedy, for joining us today as our guest speaker. Of course, Dr. Rashi Agarwal, Dr. Clement Chen, and everybody else who joined in our group today. Have a fantastic weekend and hope to see you next Friday. Bye-bye, everyone.
Thank you. Bye-bye. Thank you.
Bye-bye.